Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Seema Sehgal. Dr. Sehgal is a board-certified psychiatrist and practices medicine with the Washington Township Medical Foundation.
It's always great to be here and to do these talks. And I love it when we have a packed house like this, because I feel that the more people I can empower, the more people I can help learn strategies to manage their anxiety out of my office, I'm doing myself a favor. So this is a gift that keeps on giving me. So thank you so much for your support and for coming out here today to help support the series and also just to show your support for, what we do here for the community. So without further ado, let me get started. Today's topic, as by the turnout here is evident, is something that a lot of people struggle with. And, anxiety or repetitive thoughts are something that, yes, we hear other people suffer from, people who have defined mental illness. But all of us here present, whether we have a defined diagnosis or not, at certain points in our life, do suffer from repetitive thoughts, sort of the recurrent ruminative thinking, which, if left unchecked, can progress on to anxiety, which, left unchecked, can progress on to depression. So this is really an important topic, and since I had given a previous talk on anxiety, I thought I would pick this particular aspect of anxiety, this repetitive automatic thinking, which is at the core in terms of symptoms of both depression and anxiety, and together we are going to try and learn how to increase our awareness of their existence, their impact on our mental health, and to find tools and strategies of dealing with them. Because thoughts, I feel, are really one of the most, important generators of our wellness. Because it is our thoughts that really determine our perception, and it is our perception that influences our reality. So if we can understand our thoughts and we can change our thinking and our thoughts, we can, in effect, change our reality and change our connection to it. So let's get started. If I know how to, let's see if this works. Perfect. So a couple of wonderful thoughts to get us started. All you are is what you think about. A man's life is what his thoughts make of it. A man is what he thinks about all day long. Human beings can alter their lives by altering their attitudes of mind. And like we, had just started talking, that thoughts really are, I think, sort of the juggernaut. It's what keeps our wellness. It can take us to heights of wellness, and it can sink us to depths of depression and anxiety. So they're very, very powerful, and I think no amount of time spent on them is wasted or too much. In fact, people say that one lifetime is not enough to really understand the power of our own thoughts and to begin to have a relationship with ourselves, which in turn determines the relationship with everybody else that we have and our relationship to everything that we do in our world. Deepak Chopra, lots of you might have heard about him, says that the best use of imagination is our creativity, and the worst use of our imagination is anxiety. We are the only animals in the animal kingdom, that can actually imagine an event and mount a stress response to it. I have a little pet, I have a little Boston Terrier, and I learn so much from his behavior. There is no way that I can make him sit, have him imagine a scenario of a bigger dog chasing him, and have him become anxious about it. He just doesn't get it. So when the dog's there, his survival instinct kicks in and he runs. But the moment the threat is gone and I show him a ball, he's ready to play fetch. So he's absolutely in the moment because he doesn't have the capacity to imagine a threat, something that I think inflicts all of us. So we have to be careful about how we use that gift. The average brain does a lot of thinking, and I purposely left that blank to see if anybody here in the audience, I recognize a couple of you in the audience, so can anybody shout out approximately how many thoughts a brain thinks in a 24-hour period? It's a lot. And yes, men do think less than women, but it's still substantial. On an average, it's about 60,000 thoughts. 60, yeah. 60,000. Again, to give you an idea about how powerful and how active this is. It is continually thinking. It's thinking when you wake up. It's thinking through your day. It's even thinking when you're asleep. And it thinks not just in words. It thinks in visual imagery. We can sometimes close our eyes and think about a beautiful moment we spent with a loved one, with our child, at a wedding. And we can recreate the emotion we felt weeks, months, and years later. Similarly, we can think back on a terrible event, and we can visualize how we felt in that moment, the emotional coloration of it, and we can mount a sad emotional response to it years later. So it's powerful. And the beauty about these 60,000 thoughts is a lot of them, the majority in fact, are repetitive. We aren't Einsteins. We do not think 60 novel thoughts every day. We recycle them. We think the same thought over and over and over again, and we do it repetitively, we do it unconsciously, and we do it with such conviction that even we believe that what we think is true. There was a study done. There was a Swedish monk who decided that he was going to dedicate his life to penance and understanding the meaning of life. And after 18 years, when he re-emerged, somebody asked him, "What did you learn after 18 years of introspection?" And his response was, "I no longer believe what I think." And that's powerful, right? So again, the point being, do not take at face value what you think. It's not often true. In fact, 80 to 90% of the time, it's downright false. So contest what you think. Bring the evidence. Tell your mind, show me the evidence. Is what I'm thinking true? And if not, feel free to reject it. The big trash container, press that, down it goes. All right, so why are we talking about it so much? Negative thoughts, what they do, and we learn about that, they actually have a direct impact on our brain, on the neurotransmitters in the brain. It actually depletes our beneficial neurotransmitters, things like dopamine and serotonin. It can have, and MRI and functional imaging testing now proves beyond a reasonable doubt that our thinking and our method and our modality and our patterns of thought really impact the way our brain thinks, the way it's wired, the way we program our brain by our own thoughts. There is this BDNF, the brain-derived neurotrophic factor, which is an essential protein for new brain cell development. The more we worry and the more we are anxious and the more we have these thoughts, the less amount of this is secreted and less amount of new brain cells are stimulated to grow. And this chronic worry shrinks the size of your brain, and ongoing with the impact, it increases the size of your fear center. Now, this is an interesting concept. when we are born, again, we are the only mammal in the kingdom that requires us to be looked after for such a long time after our birth. If you think of any other mammalian creature, no mother follows its offspring for weeks and months and years, trying to protect it and help it, completely grow and mature, except us. And when we are born, the only part of our brain which is fully functional is our fear center. It's our survival instinctual center, because it is essential for survival. So I guess the cosmos thought, if this girl has any chance of survival, she'd better have that fully functional, the rest can follow. So my frontal lobes, the ones that are responsible for reasoning, my rational actions, future thinking, planning, executive functioning, it's not yet fully formed, in fact, barely at all. It's completely formed after about 22 to 26 years. So why are teenagers so impulsive? Because the only part of the brain that's fully functional, where they think from, is the immediate impulsive, immediate rewarding part of their brain. And so when I see young parents, I tell them that help the child develop conceptual thinking in sort of planning, help them build that freeway which is sort of incomplete between the back of your brain, which is ready and developed but very impulsive and instinctual, to the front of the brain. So again, how we talk to our children, how we model behavior, how we model taking care of ourselves are all important things. Of course, it increases the risk of psychiatric illness, and it changes the brain down to very, very molecular levels. Now, this way of thinking becomes destructive. And we've seen why and the impact on the brain. And yes, both depressed and anxious people tend to have more than their fair share of repetitive, negative thinking all day long. However, the nature of that thought process is different. People who are depressed tend to have a very pessimistic, a very gray outlook on life. Their thoughts will go something like, there's no point in life, I'm worthless, I'd be better off dead, the world would be better off dead, right? And so on and so forth. So there's guilt, there's pessimism. Anxious people, I'm going to die. Life is too dangerous. Something bad's going to happen. I can't cope. I can't manage. You see the level of anxiety? You see the level of engagement with that quality of thought? So even though the thinking, the engine is churning, but what it's spitting out is completely different in the two, depression and anxiety. Now, our anxiety, like I mentioned, is actually meant to be protective. And it is still the only survival tool we have. The difference is 70,000 years in our hunting, gathering, forefathers' years. It was an essential tool that got triggered with real stress, with real threat in our environment. There's a lion in the bush, I have to outrun that lion. And so the survival or the instinct would trigger this reaction, the stress response in my body. All my blood would drain to my limbs. The only thing I needed to work really well were my limbs, because I had to outrun that lion. And so everything would drain to my limbs. I would start feeling lightheaded because there's not enough brain in that time, not enough blood in my brain at the time. All my non-essential functions slow down. Digestion slows down. I don't really go to the bathroom. I'm just on hypercharged sort of a state. My skin is tingling. I can feel the hair rise at the back of my neck because I'm ready. I'm spoiling for a fight or a good run. Except that today, there is no lion in the bush. The lion is in our phone. The lion is in our computer. The lion is in our own thought. So we have the ability of triggering our own anxiety merely by how we think about a situation, about an event, past or present or future. So we are very powerful creatures. The anxiety itself can take several different forms. And I've just labeled a few of them up here: the generalized anxiety, the panic attacks that people often have, which is basically, a fancy name for a full-on stress response, where people experience all that I had just mentioned, the tingling, the dizziness, the frequent, somatic complaints, having the sweating, the raised heart rate. So all of it basically a physiological response to a perceived or real threat. So remember, it doesn't have to be real, it can be perceived. But that's the response that they mount, which is extremely discomforting, and often will land these people in the emergency room because they really do feel they're having a heart attack. And they're not, but by the time they come to me, they've had exhaustive workups, they've had thousands of dollars wasted in terms of trying to rule out a medical cause, which has its value. But I'm hoping that after being educated about it here today, that you can further educate other people that you might know who suffer from anxiety, or you've seen experience these, and sort of give them some words of advice. Now, between the depressed people and the people suffering from anxiety, the common thread, again, as we spoke, are these automatic negative thoughts, and they are called ANTS, A-N-T-S, automatic negative thoughts. And the reason they were named this by a couple of very famous cognitive behaviorists is because they likened them to actual ants that can invade a picnic. A few you can stomp out, but if there's a swarm of them, it kind of ruins your picnic. And so these thoughts, if you sort of visualize them in the same way, when you're under stress, you sort of worry, and that normal worry is a few ants that you sort of take care of them, you figure it out, and the moment passes. But there are moments where, try as you may, you cannot rid yourself of this ongoing thought process that just doesn't shut off, and so they're called ants. Now, why again, this is important? We had touched on this briefly, that our brain, the deep limbic system, which is our emotional part of the brain, really gets impacted in that the filter through which you start looking at life starts to also become gray and dulled and pessimistic. And remember that we do not respond emotionally to what is happening in our environment. We respond emotionally to what we perceive is happening in our environment. And that's a very important distinction to make, because if I was to, show a really stressful video to 3 people, not all 3 would respond in exactly the same way, because each of them view it. The event happens in real time in the world. We perceive it in our mind. We put it through a filter of our own experience, our own coping, our own background, our own strengths, our own learning, and then we mount a response to that. And that's why it's really clear, it's very important to have a clean filter. Even if you had a HEPA filter at home to clear the air in your house, you would clean that filter on a regular basis. But somehow we never take the time to look at the filter through which we view the world, and every now and then do a good deep clean and say, is this really working for me? And it's a really important piece, because you get to control how you view things, and you get to decide and choose how much and what kind of response you want to mount. So the treatment, as you can see, already begins to take shape as you begin to understand the process that our mind puts all of this through. Now, again, we've sort of, I think, belaboring the same point. And here it just, the only thing this slide really shows is that our thoughts, as we are living now in a world of artificial intelligence, we all feel threatened that we are going to become obsolete, and robots are going to take all our jobs. And they are beginning to actually teach robots consciousness. The one thing that we felt separated us from machines, that all else fails, the robots can never take our place because they can't think like a human. But what they are finding is that thoughts are nothing but electrical impulses. I experience something, that experience translates into an electrical impulse in my brain. If it's something frightening, my pupils dilate, my skin becomes a little warm, my hair stands on end, my blood pressure variation is just so, and all of this can now be recorded. So a robot, by analyzing this data, now begins to understand what fear is. When I'm joyful, the opposite happens. And so enough data can be fed into robots to understand what joy is. And so they say that, you can actually teach consciousness now to robots. I hope it's not true, but that's what they're working on. Now here's a face that makes you feel fearful right away. So just looking at an angry face, having a sad thought, having a cranky thought, having a mad thought, releases certain chemicals in the brain that impact our brain directly. So our thoughts are not as simple and innocent as we may think them to be. They're very powerful with direct impact on our brain. And our body does react to every negative thought we have. On the other hand, it does react to every positive, happy thought that it has as well. Even just looking at that little baby, it makes you sort of feel happy, it makes you want to smile. It just gives you a warm, gooey feeling. And that's the body just responding by a visual. This is not even the baby talking, or you're not even touching the baby. Just the mere look makes you feel happy. So again, just to feel how reactive we are and how all our senses are interconnected. Positive thoughts definitely help you be more productive, more effective at work. And so the most important thing today is to understand, learn, and educate ourselves about the different types of destructive thoughts that sort of flit through our mind. So I've got a list of, I think, about 9 or 10 of the commonest automatic thoughts. And I'm sure all of you will be able to identify with at least one, maybe more, of these thoughts. So let's start with the first one, all or none thinking, right? Examples would be, he never listens to me. He's always putting me down. He'll never understand what I really want, right? No one cares about me. No one will call me. So very specific and very dramatic, but very wrong thoughts. And again, we have the thoughts, we don't challenge them, and we don't say, that's actually not true. It's not always, it's just today when I need to talk to someone, I miss the fact that I'm unable to talk to someone. Or maybe the person was busy, if you're expecting a call and they haven't called, that it maybe has nothing to do with you or your situation, but something to do with the other person's situation. So again, the perspective, the filter through which you view what is happening to you is the same. And so you have to widen that, and you have to entertain other possibilities. And sometimes it's not easy because your brain, the neural pathways are so strong because you have thought this way for 20, 30, 40, 60, 80 years. So it's not just overnight going to have this new way of thinking. So you have to first contest it and say, let me pull back. What are the other possibilities? So just to invite that what you're thinking is not true is a good start. This is a red ant, particularly poisonous. Focusing on the negative or mental filtering. This is something we all do. We are all probably complicit in doing these at some points in our life, and then we all have our favorites that we do over and over again. So what is this? Focusing on the negative. If you do badly, I'm worthless. I never do anything right. And if I do something really well, it was just fluke, it was just chance. Maybe the teacher was in a good mood and gave me an A. So we don't pat ourselves on the back, we don't give ourselves credit where credit is due, but we are very quick to be punitive and harsh on what we struggle with. And so pay attention to your own inner self-talk. It really determines your state of well-being. You are what you think. So in this case, I don't know how many of you know the Pollyanna story, but a small snippet from it goes something like this. Pollyanna, she loses both her parents and is being raised by her aunt in this small village. And her father, before he had passed, they were very poor growing up, so they didn't have much to go by, and not too many presents and things that she could wish for she got. But the father taught her that in anything that happens to you, always look for something positive, something to be happy about, something to be glad about, and they would call it the glad game. And so when Pollyanna's living with her aunt, she really, really, really wants a doll, and she's never been able to afford one, doesn't have one. So some missionaries who are working in the area say, when we go back, we're going to send you a doll. So they go. Her gift arrives in a big box. When she opens it, she finds a pair of crutches. And she's really disappointed. And she says, oh no, this is not the doll I wanted. And as she's feeling sad, she thinks of her father's words. And she looks and she says, how can I be glad about this? And then she says, oh, I know. I'm so glad I don't need to use them. So again, the point here being, in whatever happens, try to find the something in it that's good. And I had that experience actually today in the morning when I was seeing my patients. I had a patient who, was talking about a couple of bad things that had happened in her life, and, how her mother had almost died in an incident and then had another very scary sort of, mishap, but she was okay. And so this patient was extremely anxious, and so much so that she had a tracking device on her mother's phone so that she could keep track at all times of where the mother was, because she's so afraid of her safety. And so I sort of explained this concept to her, and I said, another way to look at it is, your mother is still alive. Isn't that wonderful? And it's almost like she had never thought of it through that perspective or lens. She was so focused on the fear of something bad happening that she just sort of missed the point that the mother was still alive despite those close misses. So again, play the glad game. Fortune telling. I just know it's going to be horrible. I just know it's not going to work out. And I often say, so where's the crystal ball? How are you making all these prophecies, and why do you think they're going to come true? Again, we don't think. We just proclaim, and we proclaim with such certainty that we actually fool ourselves into believing it may be true. So fortune telling is again very, very common, and these are hard to pick up because they are so natural to who we are. We have lived in this body for so long and done the same thing over and over again for so long that we are not able to see how wrong it is and how really unproductive and downright harmful they can be. So the example I have here is, you have a bad day at work, you're in this sort of, not very optimistic mood, and you're already thinking, I'm going to go home, my house is going to be a mess, and it's going to be a terrible day, nobody's going to greet me. You walk in home, there's no one there to greet you, and right away you're in a bad mood. Now, who did anything to put you in a bad mood? Nobody except you. Again, you imagined a scenario, you mounted a response to this imagined scenario, you waited for it to come true, it does, and you say, there, I knew it. Nobody loves me. Nobody cares about me. So again, paying attention to our own engagement with our own thoughts is important. Mind reading. I know what they're thinking. They think I don't amount to anything. I think they don't like me. That's why they've sort of, they're avoiding me at a party. I didn't get an invite to something. They know, they've seen through my facade, and so on and so forth. You're in the office, your boss doesn't say hello to you, she's mad at me. What did I do? Again, the only filter through which you look and through which you connect to what is happening is negative. You don't challenge it. You take it as gospel. You react to it, ruin your day, and then you blame the other person for doing it. So I say to most of my patients, your most precious commodity is your mental health. Why would you farm it out to other people? Why would you outsource it to other people? If she talks nicely to me, I feel great. If she treats me well, I feel good. If he does this for me, I feel this. She, he, they, them. I say it's nobody's responsibility to take care of you but you. And the good news is, who knows better what you need to take care of you than you? And then you can stop being mad at other people for not doing a good job of what is not their job in the first place, right? So the world may treat you shabby. Why must you? So when you actually turn down the blinds, close these doors and windows to the outside world, become introspective and say, what is my role in creating my own happy or sad? The answers are right there. Thinking with your feelings. You come home, your partner is busy, you're talking about your day and they're grunting, You're like, I don't think he's paying attention to me. I don't feel loved. I feel he doesn't care. You're thinking with your feelings. You're not thinking with your logical mind. And that's why they say the longest distance in the world is the 13 inches between here and here. And it takes several lifetimes to actually walk that distance. A lot of us, we just operate from here. We are operating from an emotional place. And again, like we have, sort of talked about, the emotional place is a result of our thinking. So if you really change your thinking, you become really a sort of a detective. And I say you have to be a witness to your own thoughts and behavior. Sit here like a commentator, like a referee, like someone who's just telling you what the game is all about without playing it. So if you, and a way to do that is imagine a little you sitting here and commenting on what you're thinking and what you're feeling in the moment. So let's take an example. I come home, my husband is busy, and I start talking about my day, and he is not paying attention to me. So I begin to feel, not good. So this little me says, I don't feel good right now. Maybe because I'm not getting the attention I need. Okay? Not getting the attention because he's busy. Does it have anything to do with me? Probably not. Maybe I should check. Maybe I can ask. Honey, can you pay attention to me for 5 minutes? This is really important. Sure. I've got his attention. I can check. I feel that you didn't care. Of course I do. Why you weren't listening when I was talking? I'm sorry. Down. There. You have my attention. So if I actually check it out and I tell him what I need, what I want, rather than mounting a response on feeling belittled or ignored, it doesn't go anywhere. So when I train myself to actually understand, pick the feeling out in the moment, I can do something about it. I can do it even later. If I think about it and I come back, I can go back and say, that thing there, I just wanted to say whatever I have to say. So again, it's important to not think just with your feelings. If you do, connect the dots. Go to why it made you feel the way you did. Guilt beatings. We've all been there. I'm not a good enough mother, I'm not a good enough doctor, I'm not a good enough wife, I'm not a good enough sister, I'm not a good enough employee, on and on and on. Something happens to us in our lives which we feel is really difficult to surmount. We can take 30 years of being, say, a good parent, and in that moment we are reduced to being terrible parents because of the one thing that may have happened to us. And this is, particularly a difficult one. And the trigger words here to let you know that that's where you're at are I must, I should, I ought. right? These are very strong words. And the moment it becomes like a test. And the moment you think you should have, must have done it, there's a good chance you're actually not going to do it, right? So to again reframe and to treat ourselves with the compassion, with the love, with the kindness, with the forgiveness, when things happen to us that were out of our control, or even a realization that we may have contributed in some small part to what happened, is, I think, really, really, really powerful. And we are better friends to our friends than we are to ourselves. And really, if we all think back, we can all come up with instances where we've beaten ourselves up over something really small. And you have to again look at, why would my relationship with the most important person in my life, which is me, be so bad? And it's something I almost have to have my patients say out loud when I see them in my practice, that can you say that I'm the most important person in my life? And they look sort of aghast and they say, that feels sort of strange. I'm like, yeah, because you've never said it, you've never felt it. And so when you go with that, I think you are kinder to yourself and things are a little bit easier to handle. Labeling. We have all done this, right? What a jerk, what a cold, arrogant guy, right? So what do we do when we label people with these sort of reductionistic labels? We take away, it's sort of, and this is something we were taught in training a lot, which is, if you see a patient with a particular illness, you never say, look at that autistic child, right? You would always say, look at that child with autism. So in that, it's a distinction between the human being, the person, and what they suffer from. If I label them autistic, I'm reducing that person to just that little label, and that's it. So again, it's the awareness that has to increase about how we relate to people in our world, because that's how we are going to relate to ourselves. So if I mess up on something, I'm not going to say, oh, I was so stupid. God, I hate myself. Well, we all do it. No, I don't. I struggled today. It was tough. I did my best. I did what I could. It'll be better, right? So the tenor, the coloration, the words I use for myself really will impact ultimately how I feel about myself. Whether I feel anxious, whether I feel depressed, whether I feel that, you know what, it's okay, today was a bad day, I'm just going to rest, I'm going to take extra special care of me today because I'm really feeling down, is what I should do, not I'm already feeling down and I'm going to beat up on myself on top of that. And we do that unconsciously. So again, to make the unconscious conscious is the goal of all these exercises. Personalization. Everything that happens in my life, I am responsible for, right? My boss didn't talk to me this morning. She must be mad at me. It has nothing to do with the boss. The boss's life does not exist. Everything that happens, I am responsible. So again, look at the other side. What are the other options? And the mantra I give, my patients who are anxious and reactive and responsive, I tell them that learn to unreact. Learn to just be. Don't react. Something happens, you just observe it, you sit with it, and that's it. You do not have to bring a full-on response to everything that happens around you, because it's impossible to do and it's frustrating and takes up too much energy. So learn to unreact. Blame. If you hadn't spoken with me like that, I wouldn't be mad. If you had done the laundry and the dishes, I would be happy. Again, back to the outsourcing. We outsource our happiness to other people, and when they let us down, we feel justified in our being mad at them. So take the responsibility. Take the responsibility for your own emotions, for your own reactions, and then for your own wellness. So blame is, again, doesn't do anything. It just makes you feel worse, releasing different neurotransmitters you don't want more of. So again, unreact and say, oh well, he didn't do it, it wasn't his job to do it. It's my job to make sure I feel good. Most negative thinking is automatic, goes unnoticed. And again, they just form bad brain habits. So people will, at this point, if I'm having a discussion along these lines in my practice, people will say, what do I do about it? What do I do? And I tell them all, you don't have to do anything. Most of life is about tolerating negative emotions. If you just learn to sit with the emotion, it usually passes, it goes away, and very little really needs to be done. And it's a question that comes up often if I, talk on depression or schizophrenia. People will say, we don't know what to do when somebody says they're depressed. I have a friend who said she was feeling suicidal. What do I do? And I tell them, you don't have to do anything. You just have to be present. You have to sit with them. You have to allow them to be able to be themselves with you. I see so many patients in grief. I see so many patients, who have lost loved ones, who've had terrible losses in their life. And, one patient comes to mind who's now passed. I saw him for a total of 3 months, from the day he got a diagnosis of a terminal cancer and was sent to see me to the day he died 3 months later. And when he first came to see me, I had this sort of same reaction, what am I going to do for a minute? And then I said, the greatest gift I can give him is probably partner him on this journey. Not be freaked out, not be scared, not be afraid, and just be present for him. And it was probably in so many ways such a wonderful 3 months that taught me so much in a way that I would never have had that experience. And he was the one who actually told me, he says he was a Catholic, of Catholic faith, and he said, I don't know about what happens after death, whether there's hell or there's heaven, but one thing I can tell you, and that is that heaven is here and hell is here. And I thought that was profound and absolutely point on. And so in the wisdom, I guess, that comes with knowing that you have very little time left, the focus really sharpens. And so if, all of us can harness that energy in our day-to-day lives, I think it would enrich it in so many ways. Treatment, what can I do about all of this? And I think we've sort of alluded to, a lot of the strategies, but we'll go into the specifics now. The treatment, essentially consists of, there's always medications. I feel that that's sort of, again, my whole sort of idea about medications is the medications make you feel good enough to allow you to do the work of healing yourself. So if you're not sleeping well, you're not eating well, you're so anxious all the time, your focus is so bad, you're so distracted, you can't really focus on the work of healing yourself. So medications certainly have a role. I certainly don't think that's the only answer, but an important component. And among, the medications, the commonest ones that we use are some of the serotonin agents, and you might have heard names of, Prozac, Zoloft, Paxil. So some of these antidepressants have wonderful effects on anxiety as well, and they're commonly and widely used, fairly well tolerated, and there you have it. And benzodiazepine, Valium, clonazepam, lorazepam, Xanax. Again, they have their own pitfalls. They can be habituating. So I usually use them for a short amount of time till the other medications I might have started kick in for a longer term treatment of anxiety. So for a short time frame, they're very effective. And they have a almost immediate effect on the physical symptoms of anxiety. People who have a lot of the stress response symptoms, the racing heartbeat, the pulse, the sweating, the passing out, the dizziness. So these tend to act almost immediately within about 15 minutes. The other serotonin agents, the Prozac and the like, take about 3 to 4 weeks to really build up in your system. And sometimes when a patient is really in acute distress, you don't want them waiting that length of time. So we will give them a benzodiazepine to sort of cover that period. Buspar or buspirone is another medication which is sort of in between the two. It takes about maybe 2 weeks to kick in, not at all habit forming, doesn't act as quickly as the benzodiazepines, but not as long as the serotonin agents. It's very well tolerated and again popular to be used for anxiety. Beta blockers, this is a medication that cardiologists use a lot, the Inderol or propranolol. Again, it works on really dampening that stress response. So, the heart beating fast, increased pulse rate, it sort of just dampens all of that. So these are the 4 big categories of drugs that are very useful in anxiety. Again, we've touched on, the treatment is not straightforward. It's not as prescriptive. I can't just write a prescription and say, change your thinking. That'd be so easy, right? I do say that over and over and over again till it happens. But again, the treatment has to be, really, I think, individualized to the patient, because again, like we spoke, that our thinking is the manifestation of our relationship with ourselves, which is a product of our own upbringing, our traditional cultural belief system, our experiences, all the things we have been through, our coping mechanism, our family histories. So we are complex beings who, it takes a while to sort of, and people say one lifetime is not enough to get to know you. And I feel really at the end of the day, that is the true meaning or purpose of our life, to get to know who you are in business with. Who is this person that you're living with for the entirety of your time on this planet? So we are more externalized in our interests to get, we are more interested in what's happening around us, to people around us, than to us and within us. So again, a bit of introspection I think really helps. Our attitude is huge. What is my attitude towards my own anxiety, my own depression? Because my relationship to my panic or anxiety, my judgment of my panic or anxiety will determine how quickly I seek help for it, how seriously I take it, what value I place on getting better from it. So all of that sort of, does weigh in. And the attitudes can be, I wonder if you can, yeah, it's bigger there than it is for me. Good. So the attitude could be, I can't let anybody know. Where does that come from? I think it comes from a stigma that we all have about not talking about anything related to our mental wellness. And like I said, it is one of our most precious commodities. We should make it a point to talk about it and to say, I am not ashamed. This is sort of, a stress test. When people come to me, they're usually anxious in the context of a life event, a stressor, a loss, something that has showcased the fact that what I'm going through and how I'm equipped to deal with it, there is a mismatch. So my stressors are overwhelming my coping mechanism, and I need ways to buff up my coping mechanism. I may not be able to control what is happening in my world, but I am able to control how I relate to it, connect to it, and deal with it. So our attitude is everything. Another attitude which is really destructive is panic is bad, it's the enemy, I must never be anxious, I must keep myself from ever showing that I'm anxious. Again, our anxiety teaches us about us. So to use it as a teacher. And here, I love to sort of use the fact that it goes from being an automatic thought process. I go from going panic is bad to what can I learn from this? I have a choice. Panic is a natural, inborn, instinctual response. Yes, it's been triggered in ways and in places that are inconvenient, but by itself, panic is not bad. I want to avoid the symptoms. You cannot avoid the symptoms, right? They come at the most inopportune times, and you have to get used to it and learn from it. And I love to use the example of martial arts, and people who are training in martial arts have a saying that says, love the mat on which they practice, because they spend so much of their time face down on the mat. They're knocked down over and over again. So I say, love the mat. That's where you learn. That's how you teach yourself how to do it different, what to do different, what worked and what didn't. So be a student and let it teach you. I must relax right now. People who are anxious in certain situations, they'll clench their hands and say, okay, I'm not going to allow myself to be anxious. It's okay if you're anxious. How does it matter? I have a patient who had really bad panic attacks, so much so she couldn't leave her home to drop her children across the street. So she wouldn't go to stores or Target. And so we worked together for a while, and she sort of, got this piece that it's okay to be anxious. So she was in Target one day and she had a full-on panic attack. So she says, she came back to relate this to me subsequently. And she said, I had a panic attack. I just lay down on the floor, put my legs on my cart, and just lay there. And people came and said, are you okay? And she said, yeah, just having a panic attack. It'll pass. And they said, okay. And she's like, it was the most empowering thing I did, because now I don't fear it. What's the worst thing? It'll come at an inopportune time. I'll wait for it to pass, and it does pass. I must stay on guard. Again, you cannot predict. You cannot predict life. By definition, life is unpredictable. But what you do control is your reaction and response to it. So work on that piece rather than saying, I'm not going to allow myself to be in a situation that can make me anxious. You're going to fail. This is a test. I have to, people who are in any kind of treatment or any kind of sort of cognitive behavioral structured therapy will go out, they've been given all the tools, and they say, now you have to go out and do things that did make you anxious and see if you still get anxious. So they'll take it upon themselves that it's a test. I cannot allow myself to be anxious. No, this is practice. I'm going to put in play all the things I've learned and see how much more I still have to learn. So you see the difference in your self-talk. It's kinder, it's gentler, it's more compassionate. You don't have to be a drill sergeant all the time. You can retire that little whip that you carry in the back, the one with the spikes on it, that comes out every few minutes and gives you a few quick lashes and disappears. And then we feel, and we wonder why we feel so rotten and who's making us feel that way. So pay attention to that. The certainty. What do anxious people hate more than anything? Unpredictability, uncertainty. If only I knew, if only I can control the outcome, if only my plan is exactly so. And again, can't do that. So to tell yourself, uncertainty isn't my friend, but I can tolerate it. It's okay. It's okay to not know. So, people who have specific sort of phobias of flying, for example, patients who will just flat out refuse to climb a plane. It's too dangerous. And to them I say, total number of deaths really related to airplane, or flying in a year is 100. Motor vehicle accidents is 47,000. Pedestrians, 8,000 in a year. Accidents that kill you without leaving your home, 22,000. You think you're safe at home, you're safer in the air. So again, you have to bring evidence to your thought. You can't just hold on to it that I know. No, you don't. You're not a fortune teller, remember? You don't. And so and this is probably part of, what helps and which is part of the treatment. I keep correcting patients as they are talking. And I'll say, stop. Did I just hear that? So why do you say that? Are you really? Where's the evidence? And they will stop. And they'll say, oh, you're right. We are just automatically assuming, thinking, unchanging. So Another great way to manage your anxiety is to postpone your worries. This is an actual, proven method, which is in the course of the day when there are people who are just inundated with worry and they're worrying all day long. They can't focus on their work. They can't focus on, anything else. So we tell them, pick 2 times in the day, which are your worry times. And say for 10 minutes, twice a day, you sit on a chair which is designated your worry chair. And you sit and you worry. And you don't allow yourself to think of anything good, no happy thought, nothing, only worry. If your mind begins to stray, you say, oops, cannot do that, have to worry. Come up with more things to worry. It's amazing how it's hard to fill 10 minutes of constantly worrying. So when people say, I worry all day, it's actually not true. We worry in spurts all day long. And we just ruminate on the single thought all day long. So when you actually pull out of that and you say, let me see, how much can I worry? How much time can I worry for? So when the advantage of this is when you start to worry at a time that is inconvenient, you can just say, not now, I'll worry in my worry time. And you can actually push it aside. You can postpone that worry. And this is the 2 times that you set aside for worrying. Important thing being, even if you run out of ideas and have to repeat the same worries, you just keep on worrying till you're worried out. And then you're like, okay, I'm done. It's very powerful. Writing down our worries. Sounds so simple, but so powerful. If you had to, there are people who just worry that I think something terrible is going to happen today. Just a general worry. Something is going to be terrible today. And they can unconsciously think that 400 times. But if I tell them, write it down 400 times for me just now, I'll give them a pen and a paper, I'll say, write it down. After about the 10th, maybe 15th time, they put the pen down. This is crazy. This is too much. I'm like, well, when you actually concretize, you give teeth to those worries, you begin to see how ridiculous it is and how powerful and what a psychological sucker they are. Because we all ultimately have a finite amount of psychological energy, right? So if you're going to have a major leak from there, which is what these worries do, you have very little energy left over for things that you really want to do. So you have to sort of, seal those points and say, nope, got to keep this secure. I have to dip into it all day. So not doing it. Shifting our emotions. When you actually write down your worries or when you put aside this worry time, you are going from this passive action, which is worrying with no active control or engagement, into it becoming a very active engagement. If I have to write my worries, I have to get my paper, I have to organize myself, get my pen, dedicate time, push all my other essential work aside to put it down on paper. So it becomes an actual goal-directed event. And it gives me control, it gives me choice. How much do I want to do this? Maybe I want to move on and do something else. So it becomes from a passive sort of, motion to an actual active engagement. And that can help. Going on to sort of other mechanisms which I think are very, very powerful. And, among them, we're going to talk about meditation. We're going to talk about the breathing. And they say that your breath is really the one connector between your mind and your body. It's really powerful. And sometimes when we are anxious, just focusing on your breath is enormously calming. And you don't have to do any fancy breathing. You just have to breathe normally. But you just have to focus on the fact that you're breathing in and you're breathing out. And you just count to about 10 times of your breath going in and your breath going out. It's very, very calming and very, very helpful. And I actually recommend that you do this about 2 or 3 times in the course of your day. Take, counting 10 breaths doesn't take more than 10 seconds, maybe 15. You're just breathing in, you're breathing out, and you're just counting the fact, and you're following your breath as you're breathing in and breathing out. It really does help, and more studies show that meditative activities, breathing activities do help in really restructuring and rewiring our brain. It's powerful. Another way to breathe is now to take a long breath, a deep breath. And the way we do this particular type of breathing, we call it diaphragmatic breathing or abdominal breathing. So a simple way to know that you're doing it correct is to keep your hand over your umbilicus, and you can do it with me. Let's do one of them. So just take your right hand, put it over your umbilicus. When you take a deep breath, your stomach should go out, which means that your lungs are completely expanding in your chest cavity. So take a deep breath, and your hand should move out as you breathe in, and it'll go in as you breathe out. So breathing in, I'll stand on the side so that you can see maybe, so if you keep it here and you breathe in, out, in, out, in again, and out. So this is sort of the diaphragmatic or the abdominal breathing. And a lot of the Eastern cultures, the Indian culture calls it sort of the prana or the life force. The Chinese culture calls it chi. And the Europeans, just call it life force, and Americans don't call it anything. So they say that it's concentrated behind your umbilicus. And so if you just sort of think, pregnant women often will walk like this. They sort of walk with their hands on their belly like this. If you're fearful or you're protecting yourself from someone, you do this, right? So it's like all your energy is sort of concentrated here. So some people say when you breathe with your hand over that particular part of your body, you're sort of tapping into that energy source. Another way to breathe is to do calming counts, which is you take your breath, and here before you let the breath out, you count till 10. Then you let your breath out. So it takes a little bit longer, probably a minute and a half or so, to do this exercise. And how it helps is that when you're really anxious, it gives you that minute and a half to sort of reset, to sort of press that reset button. It calms you down, and you're back into the fray or the fight or whatever made you anxious. So it's a nice period of just calming yourself. Let's do this one together as well. It doesn't take us long. So I'm going to take a deep breath in. We're going to count till 10, and we're going to let it out. We'll do 5 such breaths. Okay? Let's do it. So hand over your belly. Sitting comfortably, you can have your eyes open, have your eyes closed. So we'll take a deep breath. I'll count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and out. Deep breath in. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and out. And last one, deep breath in. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and out. You see just how when we focus on this activity, it helps just release all the worries from your mind, because for that particular time, you're not thinking about them. You're focusing on your breathing, you're thinking about your breathing, you're connected to your body. So they're powerful in that way. Now, guided imagery for relaxation, this is another method that a lot of the therapists use, and which I think is really easy to learn and very easy to implement on your own. Essentially what it means is you think of some happy, calming place from your life. It could be imagined, it could be real. You could think of, a wonderful picnic you had someplace, a beach sort of a scene. You could think about the forest, the waterfall, even just being at your parents' anniversary party or your kid's birthday party, doesn't matter. So you just close your eyes and you bring up as vividly as possible all the aspects of that scene, the sounds, the feel, the taste, the smells, the people, everything that you can recreate about that scene. And you let yourself be immersed in it, close your eyes and just be in that moment for a few minutes. And you let yourself experience the calm, the safety, and the protective sort of feeling you had being there, the happiness you felt. And this really helps, again, reset our anxious button. It sort of dials it down a bit. And so the important thing being that you have to do these even when you're not anxious. You cannot learn how to fight in the middle of a battle. If you're having a full-on panic attack, that's the wrong time to start learning how to do these things. So you have to arm yourself in advance. You have to prepare yourself and do these meditative breathing exercises on a regular basis so that your mind also begins to understand, oh, when I feel panicked and she starts doing that, the brain gets the idea, I feel calm. I feel less stressed and anxious and on edge. I feel better. So you're sort of pairing that I'm in charge. And a question I have my patients ask is, who is the boss of your anxiety? Are you the boss of your anxiety? Or is your anxiety your boss? And so you have to reframe and say, I'm in charge. I decide. Sometimes I succeed and sometimes I fail, but I'm in charge. So when you persist and you're consistent, you do start to find results. Now, meditation, we all know, we all have heard about it, we all want to do it. None of us really, a lot of us don't find the time to do it. And I'm here to tell you that, again, all we do with meditation is putting aside a dedicated amount of time to be with our thoughts. We spend a lifetime running from them, distracting ourselves from them. And in this world that we live in, we are so concerned about our physical health, our physical well-being, the foods we eat and the stuff we put in our body. Unfortunately, not half that attention goes to what we feed our mind. We are surrounded by so much sort of addictive activities, whether it is watching movies or sports or TV or social media. It's basically feeding our mind junk. So we are inundating our mind with junk input and it just keeps collecting. We don't monitor it. We don't take responsibility for how much input I allow my brain to have. When I go home after a long day's work, I have a long, at times, sort of psychologically exhausting day. If I don't take the best care only I know how of me to ready myself for the next day, what good am I to the people who come to me? So there's no blame, there's no guilt, there's no shame in taking care of me because that's my job and I take it seriously. And part of it is not going home and turning on news and hearing about death and war and terrorism and this and that. It does nothing for me. And there's nothing I can do about it. But I can do a lot about taking care of myself by turning it down and turning on a maybe more happy channel. So paying attention to our psychological diet is really important. And how meditation sort of helps, it helps quiet our mind, it helps slow down these racing thoughts and tuning in to our own internal self. Like I said, you are the most important person in your life. Wouldn't you like to know everything about you? I mean, what could be more interesting? We are like a puzzle. And every event, every person, and every activity that we are in contact with reveals a little bit about us. So I cannot grow or mature or learn in isolation. I need people to come and sort of turn over, to unmask those little pieces that teach me about me. And so be out there, don't be afraid, learn from your experiences, come back and sort of look at them, embrace them, change them, grow from them. So again, in meditation, what I recommend, the pure diehards will say you should meditate at least 15 minutes, 4 days a week. There's sort of a prescription for it. What I say is meditate for a minute if that's all you can do, but do it consistently. And that meditation can be just the breathing we did. It can be just focusing on a non-stimulating object, and usually it can be your breathing. It can be an actual physical object where you just calm yourself, you focus on that, eyes open, eyes closed. You focus on a mantra if you have one, or a single word that you want to pick. And all you do is allow yourself to have your thoughts float by. Think of them as clouds. You can't hook a cloud. It just has to go by. So when you again become the observer of your own behavior, your own action, and you learn to unreact, you learn to just be with the emotion. That's the greatest gift you can actually give yourself, that I can tolerate my own negative emotions. I don't have to act on them. I don't have to medicate them with alcohol or drugs. I don't have to act out on them by yelling or screaming at someone. It's my emotion. My mind generated it. I take responsibility for it. I can sit with it. And so the fear that we have of our own mind, our own thoughts, slowly starts to diminish. And the focus that we had on them, the fear that it has the power to generate in us, starts to diminish. And again, done regularly, before sleep maybe, because a lot of people who have anxiety are unable to sleep well. So again, you have a very active role in calming yourself. And you can say some sort of self-talk that says, I had a terrible day today. Today was trying in so many ways, but I made it through. I somehow made it through, and I'm proud of how there were moments in the day that I really thought I was going to unravel, but somehow I pulled it through. Now it's my time to put that to rest and allow myself a night of restful sleep. When you talk, it's very much more powerful than thinking. The thinking is this passive noise in the background, but when you talk, you actually dumb down your thoughts and you focus on your words, and that itself can be meditative, it itself can be calming. And it teaches you the self-talk that can then go on in the day when you're out and about and doing your work. I recommend, my patients 3 times in your work day, put everything that you're doing down, just close your eyes and say, what am I feeling? What am I thinking? And what am I doing? If those 3 things are completely off, there's no overlap. That's the space in which anxiety and restlessness live. So if what you're thinking, right now, I'm giving this talk, that's all I'm thinking about, that's all I'm doing, my mind is not on a million other things, I'm completely focused and present here. So there's calm. And it's a great way to recenter, to sort of hit that quick reset in the day, and you get going for the next spell. So try doing that in your day. Another grounding technique. I did this today with a patient who, had recently had surgery, an older woman in her sort of mid to late 80s, very anxious. And she had had a prolapse and she had had some surgery, and she had this sort of feeling that she had to go to the bathroom every few minutes, even though it was a sensation, but not really her needing to go. So to distract her, I did try this. I told her to count 3 things or 5 things that you see. Again, you're engaging all your senses. And this is easily doable when people are getting very anxious. Just look around you to again center yourself. Count 5 things you see, 4 things you hear, 3 things you can touch, 2 things you can smell, and 1 thing that you can taste. So again, what it does is, instead of just being swept away in your thoughts, which is easy, it brings you to the here and now. Again, grounds you in your reality. Another exercise that they actually recommend is, if you're really anxious, do any mathematical skill. It doesn't have to be this. You can start counting backwards from 100, taking away 7, and go back as far as you can. It's pretty tough actually. 100 and 93 and 86, 79. So the part of your brain that has to be engaged in this activity cannot be anxious at the same time. I don't know who does this research, but it's great. So do some sort of a mathematical trick like this. Again, it sort of instantly calms. A healthy lifestyle, keeping active, eating well, nature. That's why in hospitals, if you walk around, you'll see big pictures of beautiful trees and the beach and a sunset. Somehow our brain loves all things nature, whether it's pictorial, whether it's out in nature itself. Just walking out among the trees, very calming. So in your break, if you're given to being very anxious in your work day, take little 10-minute breaks, 5-minute breaks. And even if you can't actually go out of your office, have a screensaver. That is a beautiful nature scene. Kick off your shoes and just look at that and immerse yourself in the beauty of that scene. It's very calming. Challenging your self-talk. Often anxiety is so powerful because it has gone unchecked for so many years in our minds. It's perfected that art of freaking us out and sort of, making us think the worst, drumming things up to be more than what they really are. So challenge your self-talk and say, is this really true? Where is the evidence? Show me the evidence. I say that all the time, to patients. That stop. When you find yourself getting sort of worked up, unreact, show me the evidence, play the glad game, something to be glad about. Okay, I'm practicing. I'm learning about my anxiety when you're anxious, right? If you're having a full-on panic attack, remind yourself it's not going to last more than 30 minutes. Physiologically, it's not possible to sustain a panic attack more than 30 minutes. So the worst thing that will happen is, okay, 30 minutes gone, I've got to sit this one out. Okay, I can do it. That I can do. So focusing on your strengths and really giving yourself a good pat on the back when you do something different that empowers you is important. So be your own best cheerleader. It's nobody else's job to do it. Take it seriously. It's yours. Guided meditation video for people who really want to learn more. I think there's a couple of great apps out there. There's one called Calm, C-A-L-M. There's one I think called Headspace, which people use a lot. And so some sort of guided, app that walks you through. The other advantage of doing this is, if you do this on a regular basis, the way our habits are formed in our brain, when we do something in a repeated fashion, we actually begin to associate and link and connect feelings to it. For example, I have my little Google Home on my bedside. So at night before I sleep, I have 2 instructions for my Google Home. Hey Google, set alarm for 6:30 a.m. I wish it could be 8:30, but it's been 6:30 for the last 10 years. And second, hey Google, play ocean sounds. It's beautiful. And I can be feeling any which way. The moment I start to hear those ocean sounds, I'm droopy, my lids are getting heavy, and I am ready for sleep. So it's actually the Google is sending my brain a message that when this plays, it's time for bed. So link something, and that's why I keep harping on consistency. It's really the only way to retrain our brain, is to do, it doesn't matter, you don't have to do 15 things perfectly. You have to do only one thing consistently. So pick a simple thing, something that's really easy, but stick with it. Painting by numbers, knitting, anything that's repetitive is calming. Think about a mother who has a newborn. When the baby is crying, what does the mother do? Right? The rocking, repetitive motion is calming for the baby. It puts the baby to sleep, calms down the crying. So anything that's repetitive is very calming. So it could be something very, demanding a lot of attention, like painting by numbers or knitting, just a part of your brain that is not really engaged, but engaged at the same time. I do my best thinking on the treadmill. It's when my body is working, it's distracted, and there's a clarity, and I can think better than I can anywhere else. So I know that about me, and I do use that. Listening to a podcast. There are some fabulous podcasts out there. Even if you listen to a TED Talk, you're feeling panicked, you have these anxiety thoughts. Let me put on a TED Talk on anxiety. So all you need to do is go to YouTube and say TED Talk on anxiety. You'll get about 500 hits. Pick your best, listen to something. It's powerful because you're not alone. It's the commonest mental health illness out there. It's the most treatable. 1 in 5 American has it. So, just sitting, looking around at the room, if there's maybe 40, 50 people here, it's 10 of us who have diagnosable anxiety. We are talking now really severe anxiety. And it's a spectrum. So all of us have anxiety because we are born with it. It's our friend. So think about it as a dragon. If you're trying to train a dragon, you're not going to be able to train it if you put it in a dungeon and don't give it food and you whip it regularly. It's going to become more ferocious. In order to befriend it, you have to go and get to know it. You have to let it get to know you. You have to get to know how to work with it. So your anxiety in a lot of ways is like this ferocious pet that's out of control. And rather than fear it and run from it, get to know it. Because it will be your protector. That's what it's meant for. So do not be afraid. Watch an episode of your favorite TV comfort show. Mine is The Office. You just put it on and it's just funny. There are people who just don't find it funny, and I find that strange, but I find this funny. So again, this is just a list of things that are here. A lot of resources here, and some of them are actually really good. Some that I found while I was preparing, the talk itself. There's a panicattackhelper.com. Again, a lot of tips on other activities, other things that one can do in the moment, in the immediate, in the long term. So, look at a couple of them, mindfulness, recovery. So a lot of tips. And finally, that's it. That's the end of my talk, and thank you for your attention. Thank you.